Hey guys, this is Connor with Doc Waterloo. Today I want to talk about anterior hip impingement, which is an issue I've been seeing quite a bit lately in the clinic, and actually in the gym as well. Lots of people that undergo a lot of, or that do a lot of squatting, deadlifting, and basic compound bilateral exercise for their lower body are going to encounter this at some point. Most of the time it's due to a muscle imbalance around the hip, and much of the time it occurs in just one hip at a time. So what what you'll typically see in terms of symptoms is a pain across the groin, maybe a pain that radiates down into the front of the leg, maybe it's a sharper pain all the way to the inside of the femur, that kind of thing. But you're going to have a pain across the front of the hip. It's probably going to get worse as you get into a more hip flexed position, so as you try to lower down into a squat. So most people, when they encounter this issue, is they're going to try to stretch this area out. They're going to do hip flexor stretches where they have that leg dragging behind them, and they're going to feel it cranking on the front of the hip capsule, which is going to feel uncomfortable, but it's going to make them feel like they're working on the appropriate thing, that they're stretching out the appropriate thing. And tight hip flexors probably have a huge amount to do with this, but much of the time that's only one piece of the puzzle. Much of the time, the bigger contributing factor is going to be that to achieve hip extension, which is going from hip flex position to fully extended upright as you walk, as you do your squats, as you're standing, that kind of thing. To go from that position, from flex to extended, you're supposed to use your glutes for most of that. The glutes contribute quite a bit to hip extension, and then hip hyperextension, which is the full posterior tilt of the pelvis, and they're the only muscles that are really equipped to do that extremely forcefully or very routinely. And when you have a glute that stops working on one side, or it's inhibited because it's been injured, or the low back's been injured, or the leg, or whatever it might be, what happens is the glute on one side is working normally, helps you through that hip extension just fine, and on the other side the glute isn't working, so the hamstrings start firing way too strong. So the hamstrings also help with hip extension, but they can only help you so far, and it's only one muscle, one strong muscle, where you should have two strong muscles or many strong muscles working. So if you're going through squat patterns, deadlift patterns, anything where you're going from flexion to extension, which is extremely important for everyone, especially athletes, if you're going through those patterns all the time in a bilateral sense, you have one side where the glute isn't working and one side where it is, eventually you're going to have that compensation boil over into an anterior hip impingement. So make sure that when you're dealing with this, you're activating the glutes on the side, specifically on the side that you're feeling the pain, and that you're inhibiting the hamstrings a little bit, either through foam rolling or lacrosse ball or stretching or something like that. Do those things inside of a workout, like as you're squatting, as you're deadlifting, in between sets, that kind of thing. And do something to activate the anterior core. I like side plank variations and your basic standard plank variations for that. And work those things together in conjunction with a little bit of stretching and rolling out for the front of the hip, because that alone is not going to fix anything. What you have happening there is the hamstring is pulling too hard on the femur. It's jamming the femur into the front of the hip capsule. That's pinching off that part of the hip capsule, and it's giving you that sharp, uncomfortable nerve-like pain. So address it by addressing the hamstring, getting that glute functioning, and that's your long-term fix.